Hello my dear colleagues, my name is Elizaveta. Today I'd like to share with you my honest review for Professor Bakr Rabie course named Functional Orthodontics, Autotransplantation and Retention. Why you will find this course interesting for you? Because it includes so many topics and 8 online lessons with duration of 1 hour 20 minutes to 1 hour 45 minutes. It's so exciting, isn't it? Those topics are preventive orthodontics, using functional appliances for treatment different type of malocclusions, functional appliances of treatment second class in young adults, also pseudo third class and mesial occlusion. Then course a bit changed and it includes patients with bone loss, autotransplantation, treatment of transposition of teeth, resorption and retention. Aren't those exciting? Yes, they are. So for me, why exactly I chose this course? Honestly, not in sake of functional orthodontics. I chose this course because mostly I'm an orthodontist who treats adults. Majority of my patients are adults. And I chose in sake of resorption, retention, autotransplantation, and patients with bone loss. But later on, once I started watching the course, it reminded me how important it is preventive orthodontics and why we should consider it. Because while studying in dental schools, in our universities and residentships, they mention how important it is to raise a healthy adult. But sometimes preventive orthodontics, it's a prevention from the bigger malocclusion. If we will make a tiny malocclusion, it's also considerable to go into stage 2, for example. So why I changed my perspective for that? Because Professor Bakr Rabie, whatever he says, any statement, it's based on his own studies. So it makes it trustworthy. I will give you a spoiler. In those preventive orthodontics mentioned twin block and Herbst appliances. You all remember them, right? But what's the histology marker for it? Spoiler, Indian hedgehog. And by studies, it's shown the expression of this Indian hedgehog, how to make it more intense. So later on in functional appliances, again, Herbst appliance, for example, in treatment early second-class malocclusions. Do you need to just do one big movement forward, or you need to divide it into stages? This also will be mentioned. And another question, have you ever heard of pseudo third class? Actually, I heard long ago, but I didn't consider what's the symptoms of those, how you can consider this, how you can treat that. And even while studying, I realized that I did a tiny mistake. Instead of treating pseudo third class, I chose to treat mesial occlusion. So now I understand that next time patient will come and it will be pseudo third class, I'll treat it differently. But we're all learning all our life, right? So it's okay. About bone loss patients, this is an obvious thing. We're all facing it. So how important it is, what we can do, how we can help other dentists with different specializations than ours, how we can be useful for them, how we also can help a patient without harming bone more. So it's all mentioned in there. About autotransplantation also, it's very important to know how to save at least some teeth when we have patients with so many lost teeth, right? And if we have a tiny little opportunity to use, for example, wisdom teeth for that, it will be great. It will increase our chances for more efficient treatment, right? So we should again consider this. For resorption, it's very, very often, and so many patients are facing it, including me. I also have resorption of my lower incisors after orthodontics. Also, how to prevent it, what kind of forces we should use, how we should reconsider biomechanics while we are treating the patient. Also, it's mentioned in there. About resorption, yes. About retention also, it's a very painful topic, I think, for any orthodontist, because your patient is glowing, happy, and when you debonding the system, you let them go, and after 6 months they're coming and you see some some differences from the previous photos, and it's frightening you what to do. Patient can't wear the bracket system forever, so it brings into account that for different type of malocclusions we should choose different type of retention. For example, mid-distal bite and mesial bite, how it was treated, also vertical anomalies, how it should be treated later, because we have orthodontics active period and retention passive period, right? So it's also part of the treatment. So professor also shows photos of the patient, clinical cases, also long-term, how it changes by time. It's great, by the way. Can you also do the same with your patients? Mine, once I debond the system, they are flying away or vanish. So it's also a good lesson to learn. So I really hope that you found my review beneficial, and I made you excited for this study. I hope that you will enjoy. Have a great day.